Remedy Sentinel equips non-physician staff with clinical expertise to conduct comprehensive diagnostic interviews for chronic disease. For this video demonstration, we will take you through the journey of a care coordinator reaching out to our patient John McDonald with the aid of Remedy Sentinel. We will walk through the risk stratification, HRA screening, and course correction. Sentinel delivers value on day one, even without integration with EMR systems. Out of the box, Sentinel comes with all of the clinical expertise required to assess and address chronic diseases. Once up and running, we also have the capacity to asynchronously incorporate data from your EMR and proactively leverage our virtual assessments to fill in any information gaps. As a care coordinator, I can open up the platform and review patients stratified by risk. Here, we see patients at potential risk of COPD. Today, we will select to reach out to patient John McDonald, a 68-year-old male. When the care coordinator contacts John to assess him by phone, Sentinel arms us with an initial assessment and guides us through a brief series of personalized diagnostic questions to review. Our system dynamically generates questionnaires algorithmically trained upon millions of health records, medical experts, and physician specialists. Designed to build trust, our fully HIPAA-compliant platform delivers an intuitive experience while affording industry-leading security. The HRA screening begins with questions regarding social determinants. Many diseases, such as diabetes, chronic kidney disease, coronary artery disease, and peripheral vascular disease, are asymptomatic in their earlier stages, which means we must rely on information other than symptoms to evaluate a patient's likelihood of having one of these diseases. Understanding a patient's social determinants of health gives our algorithms hints at their lifestyle, and accordingly, the lifestyle diseases they may have but not yet be aware of. Because the algorithms are able to synthesize a multitude of social determinants into a single strong prediction, we can accordingly detect asymptomatic diabetes and chronic kidney disease with about 80% accuracy, using social determinants, demographics, and basic body measures alone. Additionally, these initial questions act as friendly icebreakers, allowing John to feel comfortable, engaged, and open up to the care coordinator. Now, we turn to the clinical questions. John has been previously diagnosed with diabetes and hypertension. We also know he has high fasting triglycerides based on his last blood test that was taken 2 years ago. He hasn't been back to the clinic since then, and given his pre-existing conditions, he has been flagged as being a high-risk candidate. Let's say that John has since developed COPD, which is rather symptomatic, and stage 1 CKD, which is rather asymptomatic and easily masked by the symptomatic COPD. Sentinel's goal here is to uncover both of these new hidden diagnoses. At every step, Sentinel compiles all of the information it has collected from the patient interview and uses its artificial intelligence model to build out an intermediate differential diagnosis. After submitting only the medical history, Sentinel constructs a premature differential and begins to dive into common signs of disease to refine that differential. Based on this information, Sentinel composes the next set of questions to ask. It first wants to delve into some common indicators of chronic disease. We start with breathing-related symptoms. It turns out John has been having difficulty breathing, although it isn't worsened by laying down, so it's not orthopnea. He's been wheezing and coughing, but he's been passing it off as old age. Changes in urination can be a sign of CKD or uncontrolled diabetes. John notices he's been urinating less frequently. John isn't experiencing any chest pain. He's overweight, but not obese. And he hasn't been approaching life with the same level of vigor as he used to, but it's not due to a lack of pleasure. This distinction is important because fatigue can be due to physical disease, but also may be caused by mental illness, especially depression. Next, Sentinel decides that it should inquire about John's sleep. Sleep quality is directly related to obstructive sleep apnea, but it's also highly relevant to depression, as well as some physical diseases, including CKD. John doesn't report issues falling asleep or waking up constantly, but he does feel like his sleep quality is poor because he isn't rested when he wakes up in the morning. Besides that, John isn't snoring and isn't overly drowsy during the day, so all else seems normal. Now, John reports having a cough, but a cough can be indicative of several diseases: CHF, COPD, asthma. So Sentinel realizes it is important to delve into the character of this cough to disintermediate between the various combinations of these diseases. Let's say John's cough is chronic. It doesn't get worse in the morning, but is exacerbated by exercise, and he's coughing up sputum, so it's productive. Already, this is evidence that supports a COPD related cough. Nasal symptoms can be risk factors for asthma, but let's say none of these risk factors are present for John. Changes in hunger and thirst can be indicators for uncontrolled diabetes or CKD. But let's assume John has been doing a good job with his diabetes, and moreover, his CKD is asymptomatic enough that it doesn't have any of these manifestations. At this point, Sentinel wants to rule out CHF, but it realizes that while John reported having no chest pain, sometimes patients report chest pain as chest tightness, and sometimes CHF manifests with palpitations, but no discernible chest pain. Let's say John reports neither of these, which allows Sentinel to put a nail in the coffin for CHF. Skin issues can be a leading indicator of CKD, but John is mostly asymptomatic in this case. Peripheral cyanosis is common in gold stage 4 COPD, but let's say John's COPD is mild enough such that he doesn't display this symptom yet. Asking about mouth here for CKD. Let's say John is experiencing no mouth issues, again, because his CKD is asymptomatic. And finally, John reports that he's been coughing up yellow sputum on most days and clear sputum on some days, which is highly indicative of COPD. Finally now, Sentinel grounds all of this information into our internal ontology, and the algorithm surfaces both COPD and CKD as high confidence predictions, along with the clinical rationale for these predictions. As the care coordinator here, I am now able to communicate these insights to John and expound on the urgency of coming in to see his primary care physician. The care coordinator can also easily download these notes as a PDF for our office records, all without interrupting my care coordination workflow right at the point of care.